Hello, everybody. We are here. We are live. It's another beautiful Saturday. My mental health matters. We've been talking about depression for about 3 weeks, and we're wrapping it up in a very interesting way today. So, I have with me two special people who will be working with me to finish this in a grand way. They are my clients for today. Some people would say they're patients. We like to say clients. So please welcome with me, Kelly. Kelly, please say hi to everyone.
Hello, everyone.
Okay. And again,
Hi,
I have
Kelly.
Mr. Mr. Adeboye Bameke. He likes to be called Big Bambo. Please say hi to everyone.
Hi.
Okay,
Hello, everyone. How are you doing? My name is Boy. Yeah.
great. So now they're going to go backstage while I tell you some things real quick. And then I'll bring them in and we'll start talking about what we're here for today. So, Kelly, Big Bamo, I'll see you in a little bit, okay?
Thank you.
So, guys, we've been talking about depression. And the whole point is knowing what depression looks like, being able to help ourselves and helping other people. So we've talked about so many things. Please, if you missed the previous episodes, watch them. But today we're going to tackling depression. When we think somebody's got depression or we think we have that going on based on what we know, what do we do? How do we fight back? How do we tackle depression? That's what we're here for. And one of the things tackling depression is really seeking help for depression. So let me tell you some things real quick. I am a psychiatric mental health nurse practitioner. I prescribe medication, I do psychiatric evaluation, and we just put a treatment in place to help anybody with any mental health issue. So with depression, when you think you're having that, or somebody is recommending that you have something checked out, get these things real quick. First, please never discourage anybody from seeking help. Please never discourage anyone from seeing a psychiatrist or a psych nurse practitioner or going to even see any mental health provider for that matter. Never discourage anybody. Two, please, when they've decided to see someone and to seek help, you can help them make an appointment. But I suggest that you start with your doctor. If something is going on, it's always good to start with your primary healthcare provider, your physician, your GP, your family doctor. Why? Because some medical issues look like depression, and if they're able to check out some things, they will be able to treat those things if that's the problem, or they rule it out. For example, people with thyroid issue, they might present like they have depression. People who are just don't know that maybe they have diabetes or endocrine issues, it might look like depression. People with sleep disorder, sleep apnea, they're not sleeping well, they're tired when they wake up, it might look like depression. Some people have low blood count. It might look like depression. So that's why it's good to talk to your doctor, your primary provider, physician, family doctor about what you're feeling first. However, some of us don't have that, or maybe we have history in our family and we decide to see a psych person just to check it out. Then I say go ahead and make an appointment. With the pandemic and even before the pandemic, you can make an appointment in person or with telehealth. The clients that will be working with me today, this is telehealth. I see patients this way all the time. So you can make a telehealth appointment, or you plan to go in person. And then while you've made your appointment, don't wait, because sometimes the wait time could be very long. Make that appointment and get ready for it. How do you get ready? Start writing down your concern. Write down the questions you would like to ask or what you would like to discuss. And then if there's any form that they give to you, typically when you make appointment with us here or with a lot of psych people, they will give you some forms to fill out. For example, like a PHQ-9 or a GAD form to fill out, just to ask you some symptoms and ask some questions. What this does is it will help us prepare for you with those questions. So fill them out so that your provider gets it before you come, and we have an idea of what to probe more or how to go. It saves you and us time. Okay? Then please show up. Show up for your appointment, okay? Show up either with a televisit or you go in person. Even if you think there's no point, just show up. Just show up. It can make a difference. When you get to a psychiatric mental health practitioner, you typically won't see the lab coat that you see on our physicians in the clinic, or it depends on the setting. But typically, mental health providers, they dress up. I particularly like to dress up because I want to lighten up my patients when they see me. I don't want them to see me like they're just seeing one crazy person. So I make them feel good by dressing up like they're important. So you will not typically see lab coats and stuff with mental health providers. They typically dress up, okay? That's one good thing I like about us. And some of them will have lab coats. Maybe they work in the hospital. It depends. Then first visits are always longer. What you will see today is just an abridged version of what happens. First visit with a mental health person, it's typically an hour, okay? So because we have a lot of questions to ask. And with the visit, be ready or just know we ask a lot of questions, okay? We ask so many questions. We make you feel as comfortable as possible, but your answers is one of the things that we use. Your answers, your appearance, the things that we see are those things that we collectively put together to make our clinical decisions, okay? So fill your form and you're not stuck. Seeing them for the first time does not mean you're stuck with that person, okay? When you're searching, do your review, ask questions, and just go for it. So yes, now knowing all that, let's show you what kind of happens when we have when we come to the doctor's office. So today I'm doing televisit with my client, and I'm going to bring in the first client. Remember, privacy and confidentiality is utmost importance for us patient-doctor relationship. Confidentiality is important, but know that what happens in a psych during a site visit remains there. But today we just want you to see we're not crazy when you come to see us. We're not labeling, and it might not be what you're thinking. So I bring in my first client. Just watch us, and please pay attention to what we'll be saying, because we'll be putting back all those things for us to understand. All right, let me go in and bring my first client. Hi, how are you?
Hi. I'm good.
Okay, good. So my name is Dayo Adeyemo, and I'm a psychiatric mental health nurse practitioner. You can call me Dayo, or I'm here. So tell me, what would you like me to call you, Miss Kelly?
You can call me Kelly. Kelly's
Oh,
fine.
Kelly's fine. Good. So welcome. I can thank you for filling out the forms that I sent to you. I already looked through that, and I saw that your primary physician invited you here. Referred you to me. So, but I would like to hear more from you. There's some things I saw in your form, but just tell me what brought you in today.
Mm, I don't know. My doctor, he asked me to come check you out and see if I could, get
Get some
some,
help.
you know.
Okay. So on your form, especially the PHQ-9, which is what we use to assess for depression, your score is high. But I just don't want to go by that. I would like to ask you a few more questions and tell me more. So tell me more about your mood. You've been feeling really depressed, empty, and how long ago did that start?
Um, I don't remember. I have low energy. I'm always exhausted. I'm depressed. Um, Nothing's really going right for me right now. I just feel very empty inside.
Okay. So tell me, do you work? What's your work life like?
Um, well, I try to get out of work now. I just call in sick, but I have to go to work because I'm the only one in the house that's working. It's really rough for me.
It's really rough. Okay. So you've been calling in, missing work days? Yes. Okay.
Yes.
Well, so how about your sleep pattern? Do you sleep well? What's your typical night like?
I don't sleep actually. I almost have like insomnia. It's like I'm always in my thoughts and feeling, so sad, and tears come out my eyes, and it's hard for me.
So I saw that in your form you filled out that you've lost interest in things you used to enjoy. Can you tell me some of those things you used to do before you found yourself this way?
Well, I used to go hiking with my grandson, which I haven't done in months, and I used to go do live videos every day, and it's been a few months since I've done that. I don't have the ambition to do anything anymore.
So you don't have the ambition. You've lost interest in doing anything.
Just lost
You
it.
say you feel hopeless. You feel that way. Okay, tell me, did anything happen recently? Any recent change in family setting? Anything going on?
Yeah, well, COVID is, I don't know, just COVID and my kids moving in with me because they lost their jobs. And then my fiance left me and married some other woman. And it's been hard for me.
So if I heard you right, the pandemic has really hit your family hard. You just lost your marriage, or is are you in the process of a divorce, or you're just separated, or
No, actually, we were set to get married, and we've been together 4.5 years. And he just out of the blue called and said that he, found somebody else, and ended up marrying her. Um, 10 days after he told me that it was over, and I just am so devastated because I thought we were working things out. And I don't know, I'm just depressed, and I can't think clearly.
so did the this feeling of sadness, this low energy, change in sleep pattern, all the things that we're seeing, did it has it started before this issue with your partner, or did it get worse right after that? I'm trying to get like a timeline.
Well, it slowly started when, COVID, my work hours were less. And then the kids ended up moving in. And at that point, I'm trying to multitask. And then once the relationship went downhill, I barely eat. I just am just lost.
Okay. All right. Thank you for sharing all that with me. And so, just some other questions to have a background information about you. So, tell me, have you used any? Have you ever had a psychiatric diagnosis? Have you seen or somebody that given you a diagnosis like major depressive disorder, anxiety, bipolar, uh,
No,
anything like that before?
I don't think so.
No? Okay. Have you had any, is there anybody in the family that has such history that you know of?
No,
No? Okay. Um, do you do you have any history of assault or any domestic violence issue before?
no. I mean, no.
No? Okay. Okay. So tell me, do you use any, do you drink alcohol and if yes, how often?
Oh, now I drink it all the time. It's like my go-to thing just to try and. It used to make me really happy, and I now use it, and it doesn't make me happy anymore either. So
So you use that out of is that a way of getting yourself out of this feeling?
yeah, um,
Okay.
but
And do you smoke?
no,
Okay. Do you use any recreational drug, cocaine, heroin, anything like that?
mm,
No.
no,
Okay. All right. So and you've not been on any psychiatric admission before. Has that happened before? No. Okay.
no.
I also see here that you don't have any medical issues going on. I got your after you give me the release of information consent. I got your lab work from your doctor, and I really don't see any significant thing here. But okay, at this point, like I said, your score on that form was quite high. On the score for depression, you actually have like a score of 19, which shows moderately severe depression. And as you told me that it's affecting your functionality, what you do at home, your job, and all these things. I think that you'll benefit from medication. There are different options that we use for depression treatment, but today I would like to tell you, how do you feel about taking medication?
Well, I don't want to take a long medication for a long time. I'm worried about it.
Okay.
Um,
Okay, let me tell you a little bit more about the medication and how this works. So there are different classes of medications that we use for depression. We have because here there are like some chemicals. I will call them like I call them the brain blood. They're like they're called neurotransmitters in our brain. We have serotonin, we have dopamine, we have norepinephrine. These things have different things that they help us do: attention, our mood, decision making, activities, all those things that they help us with. But when we have a low level of them, either because we had a major issue in our lives, or it may be genetic disposition, or something that has happened, it's typically low. Like I can see you now, the presentation. That means we have a low level of this thing in the brain. And these medications just help us boost them. Maybe they're getting used up so fast, it makes it stay in the system for a little longer. And like I said, there are different classes, and each class work on different ones or more than one of this brain blood neurotransmitters. Okay, so we typically start with the medications that we use. We have the ssris, we have the snris. I won't bore you with the medical stuff, but there are five of them, and we typically use, we call some like the first line treatment for depression, which means they were FDA approved to help us with depression. So this first line are usually the SSRIs or SNRIs, and we have lots of examples of them, and they're based on your presentation. I would say let us go with maybe Lexapro or Celexa. Um, there's Flovox, there's Paxil, Prozac, Zoloft. We have all that. And you might hear that different people use different ones, but it depends on different things. But today I would choose to use one of them, which I would not say a particular one, but we're going to start at a very low dose. And then I keep monitoring you. We do visits to check in with you how you're responding to them. Sometimes we might need to go higher, and then after taking them for a period of time, the goal is for you to be able to get back to how you've been before you started feeling this way. And after being there for a while, then we might start, and if you have other things in place to support you, maybe therapy or family support or support at your workplace, then we can gradually start going down on the medications. At this point, do you have any question?
Does it cause insomnia?
Well, yeah, so let me tell you more about the side effects of the medication. With SSRI, some of the side effects we have might be GI trouble, gastrointestinal issues, nausea, vomiting. Sometimes some people might have sexual dysfunction, tremor, sleep disturbance. But the most common one, what most of my patients complain of, or that we see more often, is the nausea and the vomiting. And that's because serotonin, we have a high concentration of it in our stomach. And, when we're retaining a lot more, it might really, kind of mess around a little bit with our GI system. But this is just transient. Most cases, you experience this nausea, vomiting just when you're first starting it. So within 4 days, 5 days, or a week, it would typically go away. But because of that, I dose the medication to be taken in the evening, so that you sleep through all the nausea issue, and when you wake up, you have issue. I mean, you will feel better not dealing with the side effects. But if it's causing trouble, if it's making your sleep issues worse, we can always change it back for you to take it during the day.
Okay. And how long do I have to be on that?
Well, so psychotropic medications, some of them, they don't work instantly, like maybe antibiotics that you take for 5 days and it's over. It might take longer. We're looking at 4 months, 6 months, even 1 year. But at every level, we'll be making an assessment of how you're doing, where you are. And then from 6 months, we can start tapering you off, which means we gradually get off it, and we try to put other things in place to support you. And that's when you've gotten back to how you used to be before now. We call that remission, and we're able to taper you off it. Does that sound okay?
If you think it's best, yeah, I'll try it.
Okay. Well, I mean, it's we don't really know what is best for each person, but it is a good place for us to start. So after I'll send it your prescription to the pharmacy of your choice, the one you indicated on your form, and I would like to see you back in 2 weeks, just to check in with you to see if we're having any side effect issues, and we'll work on that. Then I'll see you back in a month. It would have been 6 weeks that you started taking it. I want to see how you're doing at that time. And then subsequent visits will be a month or 2 months, or however you need it. Does that sound okay?
Yeah.
Okay. All right. Do you have any questions for me?
No.
Not really. Okay. All right. So thank you, Miss Kelly. Thanks for showing up today. please feel free to send me any message through the patient's profile if you have any question, or and if not, I will see you in 2 weeks' time. Okay? All
Thank
right.
you.
Thank you. Okay, so that is it. It's just an abridged version of what happens. And she opted for medication. We're going to start with one of them. I purposely didn't mention any medication in particular, but there are a bunch of them, and there are different ways that people that the clinician will make the decision of what is best. For example, somebody that's having pains and stuff, they might decide to go with Cymbalta because they can use that for other things. Someone who's got OCD or presents with some OCD or anxiety issues, they might decide to go with Lovos. We have different things that help us make our decisions, and that's why we have a lot of questions. So without keeping my other client waiting for too long, let us show you something else. Okay, let's just see another way that a visit can go. And I'm going to bring in my other client now. Please stay with us. Hello, sir. Good afternoon.
Hello, hi, good afternoon.
Okay, so my name is Dayo. I'm a psychiatric nurse practitioner. So thank you for coming up for your appointment today. How would you like me to address you, Mr. Gameke? What would you like me to call you?
Well, you can call me anything, it doesn't matter. Uh, I got I mean, you can call me anything that you prefer. It's all right.
Oh, okay. I saw Big Bamo beside your name. I just wanted to be sure what you would like me to call you. But okay, that's fine.
Oh, okay. I get you.
I noticed you didn't fill out any of the forms that were sent to you when we made this appointment. Why is that?
Uh, I didn't really want to show up, even discuss this with anybody, but my friend kept on saying that he has somebody I could talk to, and then he could refer me, and then I should go through my personal physician and all that, and then your name popped up. So I must confess, I'm not. All the grammar inside is a bit too much for me. I mean, let's just, if we have to talk, we can talk. Let's fill in that form. Will just make it too kind of elaborate for me. I mean, you understand? I hope you do understand.
Okay, I do. So you really did not want to do this or talk to anyone. You didn't fill the form, but let me tell you, I'm glad that you are at least here today, and we can start from there. Okay. So you said your friend recommended seeing a mental health practitioner and seeing your doctor.
Yes.
What do you
Yes.
think prompted your friend to
No.
suggest that? Why did he or she suggest you seeing someone?
Well, I think he felt I was getting more when we do go out. I'm always a bit more tense, easily agitated, uh, getting on arguments easily, even with him. I mean, sometimes it's just a simple topic, and I take it too far. And I think my wife is also having, you know, feeling a bit funny that I hang on too long to arguments. And I think mainly they're just generally concerned. I don't know why they are concerned. I don't tell any difference in what I'm doing, really. It's just me. I don't know.
Okay.
So maybe they feel um, I'm going through a particular phase, and maybe that's why they recommended that I see someone.
Okay. Okay. I'm again. I'm glad you came to see me. So let me tell you what I'm hearing. You seem to be you to the people around you. They think you get angry easily, or maybe you get a bit irritable. Uh, they have seen a behavior change that is giving them concern,
Mm,
right?
mm.
Okay, well, so let
I
me,
think so.
you
Yeah,
think so?
yeah.
Okay, so let me ask you just
Hmm.
something. It will be from the form, but just to have an idea of what might be going on. So tell me, how has your sleep pattern be recently? Did you sleep well?
No,
Okay. How about your concentration, when you're at work? What kind of work are you a shift worker, or you just work 9 to 5?
I think I practically lose focus most times. I think I kind of drift away. I think I kind of worry. I think that's the word I'm looking for. I think I worry too much, and I think that's what they might be saying. I think my boss has also mentioned that lack of focus, and I think I'm doing okay. But I mean, I really don't see what's the big deal. I mean, I think I'm doing okay.
Okay.
Really.
So I hear worry. You worry a lot. I hear your boss is complaining about your focus at work. I hear that you're not sleeping well. So let me ask a little bit more about the worry part. What did something happen, or what do you worry about?
Uh, well, I would like to discuss it really, but if you do insist, or maybe it might help you understand what I'm going through. I think um, I think I'm having a little bit of issue with funds basically,
Mm-hmm.
and I think I'm just getting a bit worried about it, about my financial situation.
Mm-hmm.
And as a man, I'm the man. I'm supposed to be in control of things like this, and it's not working. My shifts is being reduced. Um, everybody's blaming COVID. Everybody's blaming all sorts, and I'm wondering that shouldn't affect me because I have a home to keep. Maybe that is what they are seeing, or maybe I think that's what's keeping me late up nights, not sleeping well, uh, most of the time worried. Maybe that might be it. I think that's it.
Okay. So on a scale of 1 to 10, if I want to ask you, do you feel depressed or hopeless? If we put it on a scale of 1 to 10, where would you say you are?
I think I would choose. I think I'm fine, but I would choose probably like 7 or 8. You know. But I think I'm fine. I think I'm fine. As a man, I think I'm fine.
Okay, okay. So, well, I hear two things here. I hear that there's something going on, and at the same time, I'm hearing the man part. Do you think that, okay, let's just come to human level and not talk about the man part? On a human level, do you think there's something not going right?
Yes.
Okay.
Yes.
How about your sexual life? I mean, this might be a little bit too intrusive, but it's just a way for me to really know, because it's one of those things that is very important in lives and in marriages. You talked about your wife. How is it going on? The sexual aspect. Is everything going on, or there's a decline in that as well?
Doctor, my sexual life.
Yes.
You want to know my sex? Zero.
So just
It's
the
as good as zero.
We put it at 0. Okay. And
It's as
I
good as.
That must be
That's good.
concerning for you and maybe your wife. Is this sometimes an issue?
Well, I think I have too much on my table to be thinking of other things, and I don't think I'm neglecting her. I just feel I'm just, I just have to do what I got to do, So I'm more concerned about what's on my table right now. I got so much going on, things I really got to do. As a man, I can't afford all that leisure time.
Mm-hmm. Mm-hmm.
You understand?
Okay. So, just in the context of what we're doing here today, I would like to tell you this. Again, I think it's very important for you to know that even showing up for this appointment, it's very well appreciated. And I believe, I want you to know that is a good step to take. As a psychiatric, a mental health practitioner, I deal mostly with medication management. But medication management is not the only option that people have, and it seemed to me that there's so many other things going on, but you're still able to go to work. So your functionality, looking at the severity of what I think might be going on, it might be underlying anxiety issue, it might be depression, but I won't give you any diagnosis today. I will just say maybe we have some adjustment issues going on. So we also have psychotherapy where you can talk to somebody to help. Let me ask you this: if you have the option of taking medication or maybe talking through what is going on, maybe it's just a phase, which of the two would you prefer?
I don't. I don't think it's a medication thing. No, 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 no. I'm not too sure. I don't think I want to go through that route. Uh, Psychotherapy might be okay. That means I can talk to somebody, right? And just say it out loud. Have my worries discussed, like you're doing now. Is that something you're talking about?
Yes, yes, that's
I
exactly
think
what.
I would prefer that.
Okay, good. So that's good. And you will be able to or at least talk things through. You might need medication at some point, but with all the things that I'm hearing, I think that a good place for us to start is therapy. We have light therapy. It might be some people have gut issue, nutrition issue that that might help. Some people exercise might help, relating with people might help. But with the pandemic and with everything that is going on with you, I think your wanting to do therapy, I agree with it. However, would you, can we set another appointment for me to see you, even if it's in about 2 months? You should have started your therapy session and be able to get something out of that. And then I can check in with you just to see how things are going. If at that time, based on what we're seeing, medication might help to augment, then we can talk about that at that time. How does that sound?
Uh, well, I hope I have the time, but if you insist, I mean, if you, because I don't know, but if you insist, I might just pop in for it. I would prefer the psychotherapy, like you said. I think that's more. I don't think I need medication. But if you insist that you want to see me in 2 months, if I have the time, I will come. Yeah, if I don't have the time, I hope you understand because yeah.
Yes, I would understand. But it's really nice seeing you today, and I'm hopeful that if since you're coming here today, we are agreeing on you going for psychotherapy. I would refer you to one, but just for me to check in and be sure everything is fine before I discharge you. quote and unquote, I would appreciate that. And if you can make it, I would really appreciate it. Okay.
Okay, Doc. If you insist, I will make it there.
Okay, great. I'll set your appointment and I'll see you in 2 months. I'll make a referral to another colleague, to a psychotherapist to help, and I will set your appointment for 2 months' time. Thank you so much for coming.
Thank you, ma'am. Thank you.
Okay. Yes. Okay. Thank you, everyone. Let me bring I'm bringing everybody back in. Yes, we did it. We did it. Thank you. Thank you, Big Bamo. Big Bamo is my brother. Kelly is my sister. I think we nailed it. Look at
Yes.
Kelly. See how bright and happy you are. Kelly is always a fun, lively person. She
That I am.
showed up that way just to kind of show us what the thing's like. So thank you guys. At this time, I want you to, and I'll start with Kelly. Kelly, in like, 2, 3 minutes, can you tell people what you think about mental health, how to help people, especially with depression, and maybe share a little bit of your experience? And then we'll have Big Bamo talk to us too.
Okay. My personal self, let me just tell you, mental health issues are real. They are everywhere. It's just a matter of you taking the time to, or have somebody recognize it in you. And sometimes you can't recognize it in yourself. So somebody else has to make that initiative. And I myself have suffered from depression at one point in my life. And I was on Zoloft. I did take it for about 6 months. And then I came off it once I was back to my normal, happy, peppy self. So it's all about just recognizing it and taking action. Everyone needs to take action, because ultimately, if you're healthy, the people around you will also be healthier, because you're not in a state of depression and self-loathing and low energy. And there's so many variables that a doctor can help you with. And just know everyone probably had some time in their life, unless they've had the most stellar, perfect life they've ever had. Just some of us have taken action to make sure that we can nip that in the bud and keep moving on.
Right. Thank you. Thank you, Kelly. And what do you think about, even if we're not the one and it's somebody close to us, giving them help, like, encourage them to seek help further, especially when the symptoms or the things going on, it's lasting too long. Like we saw in Big Bamo's friend. How can we help other people?
Yes. That's just it. I think that knowing and helping the people around you is key in order to recognize, especially with this pandemic going on, there's so much depression, there's so much stress, but people are not actually taking action. One, they're scared to go to the doctor. Two, they're scared of, their own personal diagnosis. And three, if you don't actually help the people that need you, you're failing them too. So you need to help them take action, at least get them to where they need to go, even if it's their regular doctor, because ultimately their regular doctor will subscribe them to go to a mental health professional.
Great. Thank you, Kelly. Thank you so much for sharing your own experience and for coming here to help me demonstrate this to help people. I really appreciate it. Okay. And let me bring in my brother now to tell us something too in like 2 minutes. Big Bamo. We did well.
What's going on? What's going on, people?
Okay, so talk to people.
What's
now.
going on? Well, if you listen well, if you had listened all along, there's this phrase, as a man. This is one of the number one killer factor for most men, especially African men. There's this thing that has been put in our brains right from when we were growing up as a man. As a man, you cannot be seen weak. As a man, you cannot be seen to shed a tear or two. As a man, you cannot be, you have to be in control. And it's a very, very, very disturbing phrase. It's disturbing because men don't really talk and they just go through this depression thing, and sometimes it gets to a suicidal level. And before you know what's happening, that's it. And it's that phrase. Oh, I can't go and see a psychiatrist. No, I can't see. No, I'm not cuckoo. I'm not cuckoo. No, no, I don't need nobody. I mean, I'm okay. I'm okay. You're not okay. Look at yourself. You know you're not okay. Your home is not okay. Your children are not happy. You are not happy yourself. Seek help. There's no big deal about it. And it's even how do you use that term? Confidential. You know, how do you use that term? Yeah, it's between you and your doctor. It's between you and your psych doctor. Nobody needs to know anything, and you can get healed. Psychotherapy, you can talk to people. You should have a go-to. I have my own go-to. My own go-to is my music. You should have your own go-to where you can be yourself, enjoy yourself, come out of that thing, and that's it. Because people go into depression easily. It's so easy, especially for men. But you need to get help. You know yourself, and you know that you're not feeling well. You need to get help. You need to talk to people. People need to talk to you. You need to go out. You need to talk to someone. Get online. Okay, COVID is not letting us go out. That's true. So you can call. You can Zoom. You can interact. You can send messages. Listen to jokes. Get out of it. It is real. Depression is real. We do not accept it though, but it is real. Especially for most men, it is real. And we need help. We need help. Get help. Thank you.
Yes, get help. Get help. You nailed it. You nailed it, Big Bamo. Like as a man. Another just something I want to add to what you said briefly is that we did it on purpose that a friend at work asked him to seek help because sometimes we might not even know there's
Yeah.
something going on, and then somebody that knows us will know you are not being yourself. Just seek help. If we are able to encourage people to, and you see, he came, it saw me, we talked about things. Not everyone that sees a psychiatrist have to be on medication. There are many options, and a psychiatrist will not force the medication on you. And even if you need it, like in Kelly's case, when she filled out that form, she was at a severely, she had moderately severe score of 19. When it gets to severe or moderately severe, medication can help at least to boost stuff up and we can bring things in. Some people, they can't afford to, maybe because of the distance, they can't go for therapy, or maybe because the home is not supportive, they can choose medication. But the best that we found is the use of both together. But it doesn't have to start together because money sometimes is a factor. Sometimes it's getting appointments is an issue, driving to where you have to seek help, so many things. But if we have support, especially among men, let's encourage fellow men when we see something going on to seek help. If you say, hey, oh boy, seek help, or hey, my man, I think there's something on, that friend would even feel comfortable to go and seek help because they won't feel that you stigmatize them or feel like it's a negative thing, and you help them out of it. So, as a man, and even in the African context, it is a big issue. Let us seek help. So, again, I really appreciate my two guests today for coming in to do this role play with us. Uh, they are not my patient, disclosure. They are not my patient. I'm a professional. I see patients. I prescribe medication. I do referral. I incorporate therapy into my sessions. But they are not my patient. Everything you've seen today, that is not everything that happens. It's usually longer. The first appointment, we ask many more questions just so that we find out what is going on. Like, for example, divorce, a change, some other things going on. We don't just slam medication on you. And sometimes we even give you the medication option. You want to think about it. We hope that you come back. The only time that we have to intervene is if during the assessment we see that you are a danger to yourself or a danger to people around you, we are obligated to intervene. So we might have to maybe call the police if you're talking about if you have a plan to hurt yourself, you already bought medication, you already bought rope, you have a gun in the house, you are thinking of killing your children, you have all those things, we will have to break that, the confidentiality for safety, and we might do involuntary commitment to the hospital when it's really bad based on the assessment. But oftentimes, most times, we just do the assessment and we both agree on the treatment that you want. Just like I did in the role play today. Nobody will force anything on you. So again, I really thank you, Kelly. I thank you, Big Bamo, for doing this with me. I thank you so much. Please let's show them some love. Let's say thank you to Kelly, thank you to Big Bamo. Show them some love in here. And yeah, so I
Thank
hope
you.
when next we call on
Thank
you in this
Thank
group,
you all.
you would answer us.
Yes, we will. I will. Give me
What
another role to play then.
what about you, Curly? When we want you to come back, would you come back?
Absolutely. You're fantastic to work with.
Yeah, we have a lot of wonderful people in this group. We have so many wonderful people in this group, and everybody has been helping in their own little way, in their own little and big way. Thank you. So to everybody watching, till we come back again next week, I think we're moving on to dementia. That's what people voted for us to move on to after depression. We had votes up for dementia and autism. More people voted for depression, for dementia. And I think that's what we're going to start with next week. So until then, we thank everybody for joining. Kudos to my guest. I appreciate you. See you all next week. Thank you.
Bye.